Hello everyone. Did you know that 90% of human beings will get gum disease at some stage in their life? I'm therefore going to discuss the treatment of gum disease because it affects millions of people around the world. My name is Periodontist and I am a specialist in gum diseases and principal dentist here at London Dental Specialists. Now, gum disease is not the most exciting topic, obviously, but please hear me out. It's actually a serious condition that can lead to tooth loss and other health problems like diabetes, heart disease, and kidney disease. But the good news is, it is also preventable and highly treatable. In this video, we're going to be diving into a 6-step guide about how to stop gum disease in its tracks. We will also be covering everything from the importance of good oral hygiene to professional treatments like deep cleaning and gum surgery. So whether you are concerned about your own gum health or you just want to learn more about this important topic, please stick around. If you like our videos, please subscribe to our YouTube channel and follow us at London Dental Specialists on Instagram and Facebook. So let's talk a bit more about gum disease. To start with, what I'd like to do is explain why people get gum disease in the first place. So let's say this is your tooth. The top third is the crown, the bit you can see, and the bottom 2/3 is the root, the bit you cannot see. Under normal circumstances, that root is held very firmly inside bone, and then your gum sits on top of it. Now, when you don't clean your teeth effectively enough for you, and I'll come back to what that means. I'm not saying you don't clean your teeth, it just might not be effective enough for you, okay? But when you don't do that, the bugs that you leave behind burrow underneath the gums and eats the bone away. So the bone levels drop and drop. And if we don't do anything about the gum disease, the bone level will carry on dropping till the tooth becomes loose and then fall out, which is obviously what you're trying to prevent by watching this video. Actually, the eagle-eyed or eagle-eared amongst you would notice that what I have just described is not very possible, because it's not possible for bacteria on their own to go underneath the gums. So what really happens is that when you leave the bacteria along the gum line due to your ineffective brushing, that triggers an immune system reaction. So your immune cells come from wherever they are in your body into your mouth to kill the bacteria. That's what they're there for. Unfortunately though, whilst they're killing the bacteria, they also break down the attachment between your gum and the teeth and then break down the bone underneath for good measure. So when your teeth first came through when you were 7 to teenage years, there was a perfect seal between the gum on the one hand and the tooth on the other hand. And as your ineffective cleaning started to happen and the immune system came into the gums to fight the bacteria, that caused a destruction of the attachment between the gum and the teeth. And so over time, the gum began to pull away from the side of the root, forming a pocket down the side of the tooth. Now, there are a couple of things that you just need to be aware of right now. Number one is, you know that many people have different skill levels in respect of how they look after their teeth. And the level of bacterial accumulation or level of cleaning, level of suboptimal cleaning, right, that allows the immune system to get triggered varies wildly amongst us. And that's why there's so much variation amongst human beings. That level is determined by your immune system. The other thing you need to be aware of is around cigarette smoking and how it affects your gums. So if I take 10 people, all of them, if this was even possible, all of them have the same skill level in respect of how they look after their teeth. Same cleaning routine. 5 smoke, the other 5 do not smoke. The 5 that smoke will get a lot more gum disease, a lot more gum and bone destruction than the 5 that do not smoke. So smoking is an independent risk factor for gum disease destruction, as is how susceptible you are caused by your genes. During your routine dental examinations, you may have heard your dentist or perhaps your hygienist read out a load of numbers to their dental nurse. What they're doing are recording the depth of the pockets that I was referring to earlier on. Now, why do they do that? Well, we need to do that because there are two types of gum pocket. Gum pockets that are 4 millimeters or less, and gum pockets that are 5 millimeters or deeper. So those measurements, those numbers, are millimeter measurements of the depth of the pocket. Over the years, perhaps over the decades, periodontal research has revealed that the bacteria inside the shallow pockets, the 4 millimeters or less, do not trigger your immune response. So let's call them the good bacteria. You will be aware that on your skin, in your gut, there's good bacteria because they're there to protect us from the really bad stuff, the really bad bacteria. Once a pocket becomes 5, 6, 7 millimeters, the type of bacteria in them change from the good to the bad. And we also now know from periodontal research that the bad bacteria are absolutely brilliant, expert at triggering the immune response. So in summary, gum disease is an exaggerated immune system reaction to the normal bacteria inside your mouth. And I say exaggerated because the level of exaggeration, remember I said, is determined by your genes. So how do we actually treat gum disease now that you understand what causes it? There are three potential options. Option one is to give you a pill to suppress your immune system. Would you take it? That was a trick question, by the way, because you do need your immune system. And if I suppressed your immune system, I would swap one small problem for a life-threatening one. So we cannot suppress your immune system, and therefore we cannot cure your gum disease. Option two is to try and get rid of all the bacteria inside your mouth. Remember, if we did that, we will get rid of the bad and the good bacteria. Plus, we've tried for decades and we haven't been successful at it. So we can't suppress your immune system. We can't get rid of the bacteria because researchers have discovered that human beings can't do it. And actually we'll get rid of the good ones as well. So option three is actually what we do. We change the type of bacteria inside your mouth from the bad ones that are very good at triggering your immune response to the good ones. And there is only one way, ladies and gentlemen, of doing that. And it is by ensuring that all your gum pockets at the end of treatment are 4 millimeters or less. Because we know, and periodontal research has shown very conclusively, two things. Number one, the bad bacteria cannot survive in the shallow pockets. And two, shallow pockets remain stable over 10, 20, 30 years. It's a very good study that was done in Gothenburg that's shown this very, very conclusively. So on to exactly the 6 steps of dealing with gum disease. Step 1, effective toothbrushing and incidental cleaning. Well, these might seem like no-brainers from everything I have just said, but you would be surprised about how many people do not do it right. Brushing twice a day for 2 minutes each time is key. And please do not forget to use interdental brushes between your teeth to get rid of bacteria in areas your toothbrush cannot reach. But it is not just about how often you brush and clean between your teeth. It's also about how you do it. So use the Oral-B electric toothbrush on the screen right now because number one, it tells you when you're brushing too hard or brushing too soft. And number two, most importantly, it has a 2-minute timer on it to ensure that you're brushing your teeth for long enough. Because we know that it takes 2 minutes to brush your teeth and brush them well. When you use interdental brushes, which are much better than dental floss, please ensure that they are cylindrical in shape so that they fit snugly between your teeth. Step 2, professional deep cleaning. Well, sometimes even with the best brushing and flossing routine, you still got gum disease. And that's usually because the problem has already started before you start to clean effectively. So if you have gum disease, you will need to see an experienced dental hygienist, dental therapist, or periodontist like myself for a professional deep cleaning. This procedure involves removal of all the plaque and tartar that have gone into those gum pockets that I described earlier on, because your brushing and your flossing cannot get into them. I know what you're thinking. Deep cleaning sounds scary. It's actually a very routine procedure, and it is essential for getting your gum disease under control. Step 3, antibiotics. In those patients where they are highly susceptible to gum disease, your periodontist may also recommend antibiotic therapy to help augment the effect of the deep cleaning. Step 4, reassessment after deep cleaning. Well, after you've had the deep cleaning, your periodontist will need to reassess your gum health to see how you're doing. This will probably involve taking some x-rays and remeasuring those gum pockets that were measured before the onset of deep cleaning. At this stage, it is really important to be aware of something, that if your deep cleaning goes perfectly and your cleaning routine becomes perfect, very little is perfect in life, but let's even say that it goes perfectly, the best you can expect is for your gum pockets to shrink by 2 millimeters. And everything has to go perfectly for that to happen. So if your gum pockets were 6 millimeters full of bad bacteria, and the goal is to get them to 4 millimeters so that the good bacteria can grow and predominate, then fantastic, if everything goes perfectly. But if your gum pocket started at 8 millimeters and it even goes perfectly, well, we're still down to 6, which is above 4. The bad bacteria will remain and trigger the immune system, which, remember, we cannot suppress. And this is where gum surgery comes into its own. Because if you have deep pockets after deep cleaning, so 5, 6, 7, 8 millimeters, you will almost definitely need pocket reduction surgery. Step 6, pocket reduction surgery, maintenance, or aftercare. Well, it's important to remember that the aim of treatment is to control the disease and not cure it, for reasons already discussed. In addition to the treatment plan described earlier on, it is important, quite frankly, crucial, that you see your hygienist every 3 months for maintenance therapy for the rest of your life. Because this is the equivalent of a diabetic patient seeing a diabetic nurse every 2 to 3 months to ensure that the diabetes is under control. Please be aware that the treatment I described earlier is highly successful, but it comes with risks, namely sensitivity to hot and cold. Well, there are treatments for this. Number 2 is root decay. It is really important to ensure that this does not happen. Number 3 is movement of your teeth. Well, braces and clear aligners can be used to deal with this movement of your teeth. And number 4, in terms of the side effects of gum treatment, is gum recession. I always tell my patients that have gum disease treatment that I am going to initially make their teeth look worse, but we cannot optimize the appearance of your teeth without dealing with the foundations first. In other words, you wouldn't build your dream house on quicksand, would you? So there you have it. You now have a 6-step guide on stopping gum disease in its tracks. Remember, gum disease is a serious condition, but it's entirely preventable and treatable. If you found this video useful, please do me a massive favor. Please click the like button below right now. It helps us spread this very important information to more and more people. Links to videos about cosmetic treatments should be on the screen right now. And if you are concerned about your gum health, don't hesitate to contact me. And please don't forget, brush, floss, and visit your dentist regularly. If you found this video useful, please share it with 3 other people. Give it a thumbs up and subscribe to our YouTube channel for more health-related tips. And if you have any questions about this video and any other video, leave some comments in the comment section and I'll be only too happy to answer them. Thank you very much.